Welcome back. As we have been showing you, we got a great taste of summer over the weekend. Lots of people downtown enjoying the sun and the 80-degree temperatures, of course. But the warm weather also brings a reminder about dangerous sun rays. And did you know May is Melanoma Awareness Month? And Dr. Alix Charles from Dooley Health and Care joins us this morning. Thanks so much for being with us. We want to get right into it. So please share with us the early signs of melanoma.
So the early signs of melanoma are a mole that has lack of symmetry. One side of the mole doesn't look like the other. The border might be irregular. It might be scalped instead of nice and smooth and round. It can have irregular colors, browns, blues, whites, even reds, and a diameter that's larger than 6 millimeters, which is the size of the end of a pencil eraser. Also, any mole that is actively changing, growing, bleeding, or its borders and colors are changing might also be a sign of melanoma.
So if you spot something that looks a little suspicious, what should you do?
Go to your doctor, give a call to your physician, your primary care physician, or your dermatologist if you don't have, if you have a dermatologist already established.
Are there particular risk factors or people who are more at risk for this?
Well, anyone can get malignant melanoma, anyone of any age, race, or background. Individuals with fair skin, light hair, light-colored eyes are at increased risk. Individuals with greater than 50 moles on their body have a higher risk of melanoma, as well as individuals who have a family history, especially in a first-degree relative with melanoma.
So what are some of your top tips for preventing it?
Well, the easiest way to try to prevent melanoma, first of all, is to be vigilant of your own skin, looking your own skin over so that you have a familiarity with what your moles and spots look like. That's if one of them changes, then you're more likely to notice. It's also important, of course, when you had a sunny day like yesterday, to wear sunscreen, at least an SPF 30 sunscreen, and reapply it every hour and a half, and also try to cover up wearing hats and sensible sun gear.
All right. Well, hopefully we'll be back out in the sun very soon. I know we have a cloudy, rainy day today, but Alicia says things will turn around. So thank you so much for your tips. And thank you, Dr. Alix Charles from Dooley Health and Care, for joining us this morning.
Thank you for having me.